Welcome to Eye Contact. I'm Sean Henahan. Phacoemulsification is a test of nerves and skill for the surgical trainee. Today I'm very pleased to be speaking with Dr. Soosan Jacob, who will share some ideas for making your early procedures less stressful and more successful. Welcome, Soosan.
Thank you, Sean.
The novice phacosurgeon will have studied the material in books and articles and watched countless videos and observed many procedures. But the first phacosurgery is a moment of truth. What suggestions do you have to help them prepare psychologically?
Yeah, I think that's a very important thing for the beginner surgeon to do, because you need to feel absolutely comfortable when you're starting out that surgery. So you have to be confident, so you should have done your background preparation, you should have gone through everything. You need to feel confident that you know the material and what you're supposed to do, including handling of any complications if they happen. But at the same time, you also need to be a little cautious, because this is the first time you're going to translate that theory into something that's on a live patient, and so you also need to have that mix of caution. It's important to kind of be on a comfort zone with your trainer and the assistant nurse. So it's nice to go and chat up with them and get on that level where you feel free to talk to them and ask for help whenever you require, and you should really have no hesitation in actively asking for help or actively asking for suggestions on how to go about this. I think you also need to be at peace and calm, and for that you need to find that place where you are absolutely calm, and this could be either through a little bit of meditation before the surgery, or whatever works best for you. It could be prayers, it could be talking to someone you love just before the surgery, it could just be listening to some music, whatever works for you. It's nice to go into that surgery with a composed mind.
Do you remember doing your first phaco?
Well, yes, it was many years ago, and yeah, we had a training program that would take us through extracapsular cataract extraction, a small incision cataract surgery, and then go in for phacoemulsification. So by the time we reached the step of phaco, we were pretty comfortable with handling the eye or understanding the eye. So which is, I think, not the case today, because the training surgeon today is exposed to the eye for the first time during phacoemulsification, and there's a lot to take in with regards to the machine, the parameters, the actual feel of the tissues of the human eye, and there's a lot that they actually have to deal with simultaneously, which I think is more difficult than what we did.
Yeah, we'll talk about the hardware. How does a trainee surgeon get familiar with the phaco equipment? There's so much to know with the foot pedals and the various settings.
Right.
Other than actually doing the surgery, is there a way to get ready so you're
Yeah, I think you have to go to wet labs, you have to check out your machine, especially the machine that you're going to be using on that day, because the foot switches, the foot pedals can vary a little bit from what you used in the wet lab to what you're actually going to be using for the first time. So go a little bit ahead of time, check it out. You have a test chamber that can be fixed to the phaco probe, so use that, and then actually sit down on that operating chair and put your foot there and feel the pedal, the various stages through which the pedal goes down, the 1, 2 and 3, the passages of the pedal. Look at that. Also at the same time, keep listening to the sounds that come, there's a buzzing sound, there's the pitches and the tones of phaco, aspiration, irrigation. All these things you need to be very familiar with so that you understand what's happening. I think the parameters as such, when you're first doing your first surgeries, may be more controlled by your trainer. So he might actually feed in the numbers, and what you actually need to concentrate on more is just the actual surgical maneuvers, and that would be more useful for your first cases.
Now, as a trainer, what do you consider a good case for a novice surgeon to begin with?
Yeah, I think you have to have a patient who's also patient, who's willing to lie down for some time. So don't take someone who's, for example, a very hyperactive patient who wants to get things done fast, because the surgery is going to take a little longer. The first eye is always a better choice than the second eye of the patient, because if he's already got his first eye operated, the surgery is going to take longer, and the patient starts to wonder what is happening, and you don't want that patient asking these questions in the middle of surgery. So the other things that you need to look for is look at the actual anatomy of the orbit. A prominent brow or a deep, set eye. These are things that are going to hinder with your movements of your hands. So you don't want that kind of patient for your first case. And also, of course, the cataract as such. You don't want very hard cataracts. So very soft cataracts, maybe if you're not in the program which starts off with soft cataracts. Posterior polars, subluxated, all these things, white cataracts. You don't want to start with those tough cases. You have to have a well dilated pupil, so look for that. Make sure you put the drops. You have to put NSAIDs so that you don't have intraoperative meiosis suddenly, and then you're looking at a situation that was good to start with, but then it turned bad. So all these things are important, as also is a good anesthesia. So for your first case, definitely don't try topical. Give a block and make the patient comfortable, and make sure that the patient does not feel any pain.
Even with an ideal patient, mistakes can happen. What are the common mistakes you see with the trainee surgeons?
Yeah, I think
Especially the first time out.
right. One of the things that should not happen is coming underprepared for surgery, which means you should have done your background work. You should have read up on the steps. You should have understood the phaco machine. You should have done some wet labs maybe, or you should have some sense of what you're going to do. I sometimes see people who come in just waiting to be taught everything afresh, which is not really a nice approach, because then you don't actually get a sense of what is happening. Things happen fast and you're not understanding what is happening, and that's not a good way to start out. So do your background work. The second thing is always review your videos. That's important. So record your surgeries and review your videos. That's an important thing. The third thing is once you've gone through your wound construction and rhexis training and all that, and then you're on to the part where you're going to be taught about how to emulsify the nucleus. Don't forget about the first steps, because they're equally important. So sometimes it becomes all about just removing that nucleus and that cortex, and that's not it actually at all. Your every step leads on to an easier next step if it's done well. And if your previous step has not been done well, it just goes on cascading down, becomes worse and worse. For example, if your incision is not good, your rhexis may not be good, and if your rhexis is not good, your nucleus removal becomes more difficult, and it keeps going like that, worse and worse. So you need to concentrate on every step and not just the step that's going to be taught to you at that time. I think the last thing I would say is surgery does not end with the procedure. You have to see your patient post-operatively, because those post-operative visits is also going to teach you a lot. It's going to teach you a lot. When you see the cornea, when you see the intraocular lens, when you see the rhexis, you understand and you correlate with what you did on the table, and that's going to make you a better and better surgeon each time.
What do you advise your trainees as far as the interpersonal or the human element about talking to the patient? Do you introduce yourself? How do you make that connection?
Right. So what you have to remember is that the patient is probably as tense as the surgeon, as the trainee, because that's their eye that's going to be operated. It's possibly going to be a first-time experience for them as well. So it's important to get that interpersonal connection, as you said, introduce yourself, make the patient feel comfortable and feel at home, and also try to decrease the anxiety levels of the patient. So that, I think, is a very important thing to establish. Also make the patient physically more comfortable.
How do you do that?
So it's basically a matter of going and talking to the patient, making sure that they are at a comfort zone with yourself. You go and talk to them, introduce yourself, tell them that everything is going to be going fine, and this is a surgery that's done routinely, and make them feel comfortable with the idea. At least you also need to tell them, as I also said earlier, that you have to give them a sense of the time that it's going to take. And don't shorten that time, err on the longer side.
It's going to take longer with a beginner.
Absolutely. So you also have to, if you think you'll take maybe in your starting surgery half an hour, you might as well tell the patient it's going to take 45 minutes, because you don't know if it's going to take long, and you don't want the patient to start wondering or asking on table as to what is happening. So always err on the longer side of time, I would say. And as I said, also make the patient physically comfortable. So make sure if they need to go to the restroom, they've done that. Make sure they're lying comfortably on the table. They're not having, for example, some people come with clips at the back of their head, some ladies, and those might poke into the head of the patient, and if you've not removed that, it's a terrible ordeal for the patient to lie for that 45 minutes with something poking into the back of the head. So these are all small things which sometimes can become problematic if they're not taken care of.
That's all very interesting. Thank you so much for talking with us.
Thank you, Sean.
For more information on this and related topics, please visit us at eurotimes.org.